Hi there, today we're going to be talking about hypertension in the cardiac system. What is hypertension? The National Institute for Health and Care Excellence, NICE, defines hypertension as persistently raised atrial blood pressure. Hypertension, or high blood pressure, is a major risk factor for stroke, myocardial infarction, heart failure, chronic kidney disease, cognitive decline, or even premature death. Hypertension is suspected by your GP or healthcare practitioner if your blood pressure level is over 140 millimeters of mercury over 90 millimeters of mercury. This top reading of 140 is your systolic blood pressure, which measures the pressure your blood is pushing against your artery walls when the heart beats. The bottom reading of 90 millimeters of mercury is your diastolic blood pressure reading. This measures the pressure your blood is pushing against your artery walls while the heart muscle rests. Globally, approximately 25% of adults have hypertension, and it is projected to affect more than 1.5 billion people worldwide by 2025. Stages of hypertension. Normal blood pressure is between 90/60 and 120/80. Elevated blood pressure, or prehypertension, is between 120/80 and 140/90. Stage 1 hypertension is between 140/90 and 159/99. Stage 2 hypertension is between 160/100 and 180/120. Stage 3 hypertension, or hypertensive crisis, or severe hypertension, is 180 millimeters of mercury or higher, or 120 millimeters of mercury diastolic reading or above. The cardiac system. The cardiovascular system provides oxygen to all the cells and tissues in the body to enable normal function. Hypertension can affect the cardiac system by reducing the elasticity of your arteries. The walls of the arteries can become damaged. More fatty deposits can build up. Here is an image of your cardiac system. There are three main components, and these are capillaries, veins, and arteries. Hypertension can lead to a build-up of fatty material called atheroma in the artery. This narrows the arteries, restricting blood flow. Diabetes and obesity can also cause this. The narrower arteries cause an increase in pressure. The heart has to work a lot harder to keep the blood pumping around the body. The narrower the vessels, the higher the pressure in the arteries. So the image on the left is a healthy artery, and the image on the right is an unhealthy artery with atheroma, which is the fatty material. The risks of hypertension. If your blood pressure is too high, it puts extra strain on your blood vessels, heart, and other organs, such as your brain, kidneys, and eyes. The risks are heart disease, heart attacks, strokes, heart failure, kidney disease, vascular dementia, and coronary artery disease. Please read the descriptions as stated. Signs and symptoms of hypertension. These symptoms shown in the image are for severe hypertension when medical attention is needed immediately, so typically in stage 3 hypertension as outlined previously. Headaches and blurred double vision are the most common symptoms of hypertension. Management and self-care. So lifestyle changes are one of the most important ways to manage your blood pressure. So stopping smoking, eat a healthy balanced diet, cut down on your salt intake, cut down on alcohol, reduce caffeine intake, exercise regularly, achieve a healthy BMI if you're overweight, get the correct amount of sleep for your age group, and manage stress in your life. Sometimes lifestyle changes may not be sufficient, and your GP or healthcare professional may need to prescribe medication. The importance of managing your hypertension. It is very important for you to make these lifestyle changes to reduce the likelihood of the risks as outlined previously. The BHS and international guidelines recommend diet and lifestyle changes for all patients with high blood pressure, no matter their weight, how severe their condition is, or whether they take medication. These changes can reduce the need for medication and its side effects, lower drug costs, and improve other health conditions like diabetes and high cholesterol. Please see why exercise is important. Important things to remember. Any exercise is better than none, but don't overdo it. Lifestyle changes are extremely important to lowering your blood pressure. Regular blood pressure checks are beneficial. Healthy boundaries. Learn to say no when you need to and set boundaries that protect your mental well-being. Stay close to supportive, understanding people. Reach out to trusted friends, family, or professionals when you need help. Sometimes hypertension needs to be treated with medication, especially with stage 2 and 3. Thank you for listening.